Okay, Chapter 17, Infection Prevention and Control in the Hospital and Home. Children are often irritable and may have fever during the incubation and prodromal periods. That's important to know. There are 4 stages of infection. We have stage 1, the incubation period, stage 2, the prodromal period. So again, children are often irritable and may have a fever during the incubation and prodromal periods. Infectious diseases can be spread before the symptoms of the disease are fully realized. So incubation period starts when the organism first enters the body and lasts until the onset of symptoms. Infection can be transmitted during this phase, for sure. During prodromal period, that is a short time from onset of vague symptoms to the onset of specific disease symptoms. This stage, the person is highly infectious. Then we have stage 3, the illness period. Localized and systemic symptoms appear, such as fever, headache, malaise, leukocytosis, rash, swelling, wound drainage, diarrhea, and vomiting. Severity and duration depend on virulence of the pathogen and the person's susceptibility. Stage 4 is the convalescent period, and it begins when the symptoms begin to subside and continues until the person returns to normal. Healthcare-associated infections are transmitted while the person is receiving healthcare services. Healthcare workers can also contract an healthcare-associated infection. Patients that are at the greatest risk for acquiring these healthcare-associated infections include surgical incisions with or without drains, artificial airways, urinary catheters, IV lines, implanted prosthetic devices, repeated injections or venipunctures, and immune compromise. Prevention and control. We're going to use medical and surgical asepsis, standard precautions, and transmission-based precautions. We will use strict aseptic technique. So when we use strict aseptic, that's sterile technique, right? And we use that whenever we do invasive diagnostic or therapeutic procedures, like putting in an IV catheter, putting in a urinary catheter, any surgical procedures of any kind. So aseptic technique is surgical technique. That's your surgical technique. So I want you to think of surgical technique, aseptic, and what's the other one? Sterile. Okay, those words are all used interchangeably. Isolation is used to prevent contact between patient and others. Infection prevention and control involves monitoring diagnostic reports related to infection, observing patients for signs of infection. What diagnostic reports are associated with infection? I want you to think about that. When you're looking at the labs, what are some labs that are going to give you an indication that an infection is brewing? We'll talk about that in class. What signs and symptoms are you, when you're doing your vitals, what vital is going to indicate to you that a person is experiencing a fever? Oh, excuse me, I just told you. Experiencing an infection, it's going to be a fever. Oh, you got that one free. Implementing procedures to contain microorganisms, proper handling, sterilizing or disposing of contaminated items, and using approved sanitation methods. That's important too. Recognizing individuals at high risk for infection and implementing appropriate protection. Infection prevention and control techniques have undergone many changes over the past 3 decades or so in the United States. Current precautions are based on guidelines and regulations developed by the CDC. We're seeing this very much so when we think about COVID, right? And the Occupational Safety and Health Administration, or OSHA, both the CDC and OSHA work together in terms of these things. Initially, isolation techniques focused on hospitalized patients, but the evolution of HIV, hepatitis, Ebola, and even COVID, right? We know that has broadened the focus related to infectious diseases. Infection prevention and control practices are focused on protecting patients, healthcare workers, family members, and social contacts in all settings. We have standards. So our current standards, we have standard precautions, transmission-based precautions. Tier 1 is standard precautions. Tier 2 is considered transmission-based precautions. And transmission-based precautions are interrupting mode of transmission by identifying specific secretions that might be infective. Transmission-based precautions we can use those alone by themselves or in combination with just our regular standard precautions. Again, I know I said this yesterday or on Monday, but standard precautions, we use standard precautions for all patients. All patients are considered to be under standard precautions. Then we have airborne precautions. Airborne precautions include measles, varicella, and TB. Remember TB, we use a special mask called an N95. Droplet precautions include meningitis, pneumonia, diphtheria. In contact precautions are going to be GI, skin, or wound infections, RSV, and herpes simplex. Those are some examples. Okay, so when we talk about PPE, personal protective equipment, never touch with your bare hands anything that contains fluid from a body surface or cavity. Gloves are to be worn for contact with body fluids of any sort, including saliva, urine, feces, and blood. The only times gloves are not worn is for contact with intact skin or unsoiled articles. Does anybody know or remember from lab? Some of you haven't done this in lab. You'll do it tonight. But in what order PPE should be donned if full PPE is required? I'll give you a few seconds to think about it. So to put our PPE on, the correct order to do so is going to be the gown, then your mask or respirator, then your goggles, and then finally your gloves. What order should we remove our PPE? We're going to remove it in almost the exact same order. There's just one little difference. So the sequence for removing is gloves, then our face shield or goggles, then the gown, then our mask or respirator. All right, now when we talk about nursing process, I did introduce to you guys the nursing process. Remember, nursing process is ADPIE, A-D-P-I-E. We're going to start with assessment. Assessment is our data collection. So we're going to assess for signs of infection that may require transmission-based precautions. Wounds should be assessed each shift for infection. We're going to always monitor our patient's temperature. Admission lab studies may indicate an infection. Then when we move into the diagnosis part of the nursing process, we're going to think about what potential problems do we have here. And we will talk more about nursing diagnosis this upcoming week, and what a nursing diagnosis looks like. But when we're talking about infection, it would be something like risk for infection related to surgical wound, open wound, or a weakened condition, and we would continue after that. Then when we move into the planning phase, so speaking to the patient in advance via an intercom can help ensure you have everything necessary when you put on your PPE before you go into the room. The planning phase is the phase of the nursing process where you work with the patient to come up with a plan of care. An expected outcome in terms of infection would include no healthcare associated infection is evident. So that would be we set goals in our planning phase. When using transmission-based precautions that require putting on PPE, I already told you guys that we would always communicate to the patient before we go into the room to make sure we have everything that we need. The implementation phase. So I want you guys to write right now. We can talk about this now. Implementation and =, interventions. Okay. Patient teaching is needed on the disease process, the modes of transmission, and precautions to prevent infection. And standard precautions are used for each contact with the patient at the bare minimum. Hand hygiene is the most important intervention we can do to prevent infection transmission. We are going to wash our hands before and after all contact with our patient, wound care, or any invasive procedures. We are going to wash our hands or perform hand hygiene before putting on gloves and after removing them. Always, always wear gloves when collecting specimens of blood, urine, feces, nasal secretions, and gastric content. Handling contaminated linens. You want to roll and hold the linens arm's length away from the body. Deposit all contaminated items in isolation containers within the patient's room. Demonstrate the proper use of disposal isolation containers. So make sure that we're using trash and biohazard waste. We spent a lot of time talking about that. Make sure that we're using sharps containers. Do we ever recap a needle? No, we never recap needles. All sharps are dropped into the sharps container. Anything that you think may cause a skin tear or cut a person goes into a sharps container. We always replace our sharps containers when they're approximately 2/3 full. Reusable equipment, we want to always make sure that it's cleaned. If it's visibly soiled, then send it to central supply to be disinfected. What are natural defenses? Natural defenses, we want to institute measures to enhance the patient's natural body defenses, such as protect intact skin, promote a balanced diet, provide an opportunity for sleep, and decrease stress. All of those are going to help our immune systems. General guidelines for isolation precautions. The patient placement. So patients who need transmission precautions should be placed in a private room or with another patient infected with the same organism. When we transport the patient, we want to avoid transporting patients that are on transmission precautions unless it's absolutely necessary. The patient must wear a mask when they are outside the room. Infection prevention and control in the home. We want to keep clothing and linens away from others until they're washed teach the patient and family proper hand hygiene techniques, disinfect the bathroom with a 1 to 10 bleach water solution, and wash dishes in scalding water and let them air dry. We can use a heavy plastic jug with a secure top to hold needles. We can want to make sure that we use clean gloves for wound care or dressing change and teach the family how to remove soiled gloves. Clean the patient's room frequently. Protective environment. So protective isolation is a patient in a special room with its own ventilation system. No one with active infection is allowed in the patient's room. Remain aware of your facility's policies and procedures regarding protective isolation and follow them at all times. Physiological aspects of isolation. The patient in transmission-based isolation precautions is at risk for decreased self-esteem and sensory deprivation. Signs of psychological aspects of isolation include boredom, slow thought, disorganized thoughts, excessive sleep during the day, anxiety, hallucinations, and panic attacks. Infection prevention and control for the nurse. So OSHA regulations protect healthcare workers from exposure to bloodborne pathogens in the workplace. 3 main modes of occupational exposure to bloodborne pathogens include puncture wounds from contaminated needles or other sharps, skin contact allowing blood, body fluids, or other potentially infectious materials to enter through damaged or broken skin, and mucous membrane contact allowing infectious materials to enter through the mucous membranes of the eyes, mouth, and nose. So again, let's talk about surgical asepsis or sterile technique. There are 4 rules of surgical asepsis. Know what is sterile, know what is not sterile, separate the sterile from the unsterile, and remedy contamination immediately. The goal of surgical asepsis is to keep an area free from microorganisms. Surgical scrub is more lengthy and vigorous than a regular hand washing. The goal here is to remove as many microorganisms as possible without damaging the skin. Timing is based on actual time spent scrubbing, not including rinse time. The surgical scrub usually is 2 to 4 minutes. Brushless technique with antimicrobial agent may be used. When we open sterile packages, we're going to first perform hand hygiene. Open the sterile package away from the body. Touch only the outside of the wrapper. Do not reach across the sterile field. Always face the sterile field and allow at least 6 inches between the body and the sterile field. In the evaluation phase, this is the last step of the nursing process. In the evaluation phase, patient that is recovering without additional instances of infection from other microorganisms or infection of other body areas, we are going to assess, as nurses, we're going to assess whether the patient's infection has been transmitted to any healthcare worker or any other patient on the unit or in the hospital. Question number 1. During which stage of infection would a patient be irritable, fatigued, be experiencing malaise, have an elevated temperature, and be considered highly infectious? Number 1, incubation period, 2, prodromal period, 3, illness period, or 4, convalescent period. So the correct answer is number 2, the prodromal period. Question number 2. Mary is taking care of a patient with tuberculosis. What specific type of precautions should Mary take? Number 1, standard. Number 2, airborne. Number 3, droplet. Or number 4, contact. The correct answer here is airborne. Question number 3. When taking care of a known tuberculosis patient, the nurse must wear number 1, sterile gloves, number 2, sterile gown, number 3, particulate filter mask, or number 4, shoe covers. It is number 3, a particulate filtered mask. It's our N95, right? A special mask must be worn when caring for patients with airborne transmitted diseases. The same is true with COVID-19. When opening a sterile package, a nurse should do all of the following except number 1, select a moist tabletop at eye level. Number 2, wash hands and obtain equipment. 3, open packages away from the body, opening the distal flap first. Lift the front flap up and toward the body, handling only the outside wrapper. That's right. The correct answer is number 1. We are not going to use a moist tabletop at eye level. We do not need that or want that.